My entire right side of my face was covered in lesions. My scalp was covered in lesions.
A severe case of shingles sent Tracy Fine to a Wisconsin emergency room. She found a hospital packed with COVID patients.
The nurses kept telling me it's just crazy in here.
She says she spent 13 hours on a gurney in a hallway waiting for a bed.
They made me suffer longer than I needed to. I was in just excruciating pain.
Hospitals in the state are so crowded now that doctors and nurses took out a 2-page ad addressed to the people of Wisconsin. It said, "Without immediate change, our hospitals will be too full."
Because we're already busting at the seams.
Yet we found hundreds of beds empty at Wisconsin's Makeshift alternative care facility in Milwaukee. The state reopened it in mid-October for overflow coronavirus cases.
This is not just about if you need hospitalization for COVID. This is about crowding out our hospitals for every other type of care that any one of us could need.
But about 2 months later, with the strain on hospitals growing, there are just 7 patients at the alternative care site, with space for 530. The problem? COVID patients have to be stable enough to safely move from a hospital, and they have to agree to go.
They say, thank you, but no thank you. And I think part of that is, they think that this is like the TV show MASH with tents flapping in the winds and Jeeps driving around. It's really not. It's a great facility.
We obtained this list from the U.S. Army Corps of Engineers of all 38 makeshift sites built last spring. We found many of the biggest locations are closed now with no plans of reopening. That's even with the post-holiday surge of infections stretching hospitals to the limit. Detroit, D.C., Chicago, and New York say their field sites are mothballed because hospitals there can still handle demand for now.
We have the ability, if we need to go and, fire up a field hospital.
The Army Corps built a 2,000-bed clinic in Denver. It's also vacant. A state official tells us hospitals still have bed space, and the priority now is to fill extra staffing needs. As Stacy Fine learned, even when a state activates a makeshift care center, it may stay unused while hospitals remain overwhelmed.
It's really scary to be that sick and to feel like your healthcare providers are too distracted to give you the care that you really need.
Patrick Terpstra, Newsy, Washington.